Let's take some time to talk a little bit about labiaplasty, which is a procedure that I perform often in my practice. Patients that are seeking labiaplasty often come because of functional reasons. Either the labia are redundant or asymmetric. Sometimes the labia get caught in their clothing, or after urination, they become irritated because of urine stream over the labia. Also, there are sometimes where after pregnancy, the labia have changed due to episiotomy or due to surgical procedures around childbirth. So what are some of the things that we can do with labiaplasty? Well, we can do procedures to reduce the redundant tissue that's there to improve the overall function and the overall shape of the labia. We can also do procedures to correct episiotomies or to correct deficiencies or lacerations to the labia. It's important to understand that all these procedures are designed to improve the cosmetic result, but they're also functional, and there's a limitation to what we can provide. It's important to not over-reduce the labia because the labia serve a functional role. Not only are they sensate and important for sexual function, they're also important for maintaining the moisture content of the vagina and to reduce irritation in that regard. So when you're considering a labiaplasty, you have to be sure to have the right technique and the right surgical approach. Now, my technique with most labiaplasty involves a wedge, and the reason why is because the labia are shaped something like the wing of a butterfly. And what's important to understand is that the nerves that supply the labia travel from the inside out, somewhat like a fan, the shape of a fan. So if you do a trim where you cut just the outer edge of the labia, that can decrease the sensation and sensitivity to the outside of the labia. That reduces the functional regards of the labia and the functional aspects of the labia. If you do a wedge where you remove that tissue from the middle and then close the labia together, it helps to preserve sensation and function ultimately of the labia over time. This is really critical, and in my practice, I like to utilize functional approaches. I don't want to decrease sensation to the labia, and I want to remove just enough, but not too much, in order to preserve the function of the labia and the vagina. Many patients ask me to improve the quality of the way things look, but they also want to have functional results. And most women that come in truly are very happy with the way that they're shaped. They just want to have a small change, a small tweak in the way things look, or an improvement in, again, that function so that it doesn't get caught on their clothing and doesn't have other functional issues. So these are all important questions to ask and important parts of the discussion when discussing labiaplasty.